Your legs feel heavy. Your knees feel stiff. And when someone says, just go for a walk, your body quietly says, I can't today. What if I told you a surgeon with 30+ years of experience says walking is not the best exercise after 60, and there's a much safer, simpler movement that protects your knees, improves circulation, strengthens your heart, and can be done sitting down? This is not a fitness trend. This is not a gym routine. This is something surgeons quietly recommend to their own parents. If you're over 60, stay with me, because by the end of this, you'll know one simple exercise that many seniors say feels better than walking, especially if you have knee pain, poor circulation, balance issues, neuropathy, or fear of falling. Let's start with the truth no one says out loud. Walking is good, but after 60, it's not always safe. As we age, the cartilage in our knees thins, the cushioning in our hips weakens, the nerves in our feet lose sensitivity, balance becomes unpredictable. Surgeons see this every day. They see seniors who started walking for health and ended up with knee inflammation, hip pain, plantar fasciitis, sciatica, or dangerous falls. One wrong step on an uneven sidewalk, one dizzy moment, one misjudged curb, and suddenly a simple walk turns into months of recovery. That's why many orthopedic and vascular surgeons quietly say this: after 60, the best exercise is the one that improves circulation and strength without joint impact or fall risk. And that exercise is called seated marching with controlled foot pumps. It may sound simple, but simple doesn't mean weak. In fact, surgeons say this movement activates more circulation pathways than walking without stressing your knees or spine. Here's why it works so powerfully. When you walk, blood has to fight gravity to travel back up from your feet to your heart. But aging veins often have weak valves, so blood pools in the legs. That's why so many seniors experience swollen ankles, cold feet, tingling or numbness, heavy legs, varicose veins. Walking alone doesn't always fix this, but this exercise directly activates the calf muscle pump, which surgeons call the second heart of the body. Every time you flex and point your foot, the calf muscles squeeze deep veins and push blood upward, efficiently, safely, and gently. Now let me show you exactly how surgeons recommend doing it. Sit on a sturdy chair, back straight, feet flat on the floor. Lift your right knee slightly, just a few inches. At the same time, point your toes forward. Lower the foot back down slowly. Now lift the left knee and point the toes. That's one cycle. Go slow, controlled, breathing normally. After 10 marches, keep both feet on the floor and do foot pumps. Lift your heels while keeping toes down. Then lower heels and lift toes. This movement sends blood flowing upward like opening floodgates. Surgeons recommend 2 to 3 minutes of this movement, 2 to 3 times a day. Many seniors notice warmer feet within minutes, but that's only the beginning. This exercise doesn't just help circulation, it strengthens the muscles that keep you standing. Walking mainly works forward motion muscles, but this exercise activates hip flexors, quads, calves, ankles, and core stabilizers, the muscles that prevent falls. Surgeons say falls rarely happen because of weakness alone. They happen because the brain and muscles stop communicating clearly. This exercise restores that connection. Every controlled lift sends signals from the feet to the brain, sharpening balance awareness. That's why many physical therapists use this movement after surgery before allowing patients to walk again. Now let's talk about the heart. Walking is often recommended for heart health, but for seniors who can't walk long or fast, heart benefits are limited. This seated exercise raises heart rate gently without spikes. Surgeons prefer this for seniors with high blood pressure, heart disease, shortness of breath, or fear of overexertion because it improves circulation without stressing the heart. Some seniors even do it while watching TV. Now here's something most people don't know. Walking does not lubricate knee joints as well as controlled seated movement. Surgeons explain that cartilage absorbs nutrients through gentle compression and release, not pounding. This exercise compresses and releases the knee joint without impact, feeding cartilage and reducing stiffness. That's why many seniors report less knee pain after just 2 weeks. Let's talk about neuropathy. If you feel burning, tingling, or numbness in your feet, walking may actually worsen symptoms, but this movement stimulates nerve endings gently. Surgeons say improved blood flow helps nerves heal, or at least stops further damage. Many seniors report less nighttime foot pain when they do this exercise before bed. Now here's how surgeons suggest making it even more powerful. Add light resistance. You don't need weights. A simple resistance band around your thighs or even a simple folded towel adds muscle engagement. But even without resistance, this movement is enough. Consistency matters more than intensity. Surgeons would rather you do this daily than walk once a week. Now let's address a common question. Can I stop walking completely? Surgeons say walking is fine if you enjoy it and feel safe, but if walking causes pain, fear, or exhaustion, this exercise is a safer alternative. Many seniors combine short walks with this seated movement. Now let me share what surprises many people. Some seniors lose belly fat doing this, not because it burns massive calories, but because improved blood flow and muscle activation improve insulin sensitivity. Better blood flow equals better metabolism. Now let's talk about breathing. As you do this exercise, breathe deeply. Inhale through your nose as you lift. Exhale slowly as you lower. This activates the parasympathetic nervous system, the calming system. Surgeons say stress reduction is just as important as movement after 60. High stress tightens blood vessels. This exercise relaxes them. Now here's what not to do. Don't rush. Don't lift too high. Don't hold your breath. Don't force through pain. Pain is a signal, not a goal. Surgeons say pain means stop and rest. Now let me tell you about real outcomes surgeons observe. Seniors who do this daily often report less leg swelling, fewer nighttime cramps, better balance, more confidence standing up, less fear of falling, more energy. Confidence matters. When seniors feel confident in their bodies, they move more naturally. Stiffness creates injury. Injury leads to injury. This exercise breaks that cycle. Now let's address something emotional. Many seniors feel frustrated when their bodies don't move like they used to. Walking used to feel easy. Now it feels like a chore. Surgeons say the goal after 60 is not to push the body. It's to work with it. This exercise respects aging joints while strengthening them. It says, I'm still moving, I'm still capable, and that mindset changes everything. Now here's a simple daily routine surgeons recommend. Morning, 2 minutes of seated marching and foot pumps to wake up circulation. Afternoon, 2 to 3 minutes after sitting for long periods. Evening, 1 to 2 minutes before bed to reduce nighttime cramps. That's it. No gym, no shoes, no weather concerns. Now let's talk about safety. This exercise is safer than walking for many seniors because you're seated, no fall risk, no joint impact, no uneven surfaces. Surgeons say safety equals consistency, and consistency equals results. If you stop moving because walking hurts, health declines. This exercise keeps you moving when walking isn't possible. Now imagine this. You wake up, your legs feel lighter, your feet feel warmer, standing up feels steadier. That's what circulation does. This isn't about becoming athletic, it's about staying independent. Surgeons say independence is the real goal after 60. being able to stand up alone, walk to the kitchen safely, climb a few steps without fear. This exercise supports all of that. And here's the most important thing surgeons emphasize. Start today, not tomorrow, not next week, because circulation improves fast, but only if you begin. Even 1 minute is better than 0. Your body responds quickly when treated gently and consistently. So before you lace up your shoes and force a walk that hurts, try this simple seated exercise. Your knees will thank you, your heart will appreciate it, and your confidence will slowly return. Because after 60, the best exercise isn't the hardest one. It's the one you can do every single day, safely, comfortably, and without fear. And sometimes, the simplest movement makes the biggest difference.